Hello everyone and welcome to AceOSCE's video for today. I am Alicia and today I will be going through an OSCE case where we will be doing a plain counseling. I know now a lot of people may be thinking it's just a plain counseling, why are we going through this? There are harder cases to go through, which I do agree with you on. But in my practice, when I'm trying to teach students and prepare them for their OSCE, I do realize that a lot of us get stuck in the easiest cases. We do forget most important points in counseling. Sometimes when we don't have the patient's profile, we're not able to ask them the right questions before we counsel. So I do want to go ahead with those and give you guys a little bit of a heads up. Again, guide you with things you want to keep in your mind when you have different sort of counseling cases, especially when it's a device demonstration. So let's have a quick overview of today's case and let's get started with the case for today. So outside your door, you see the following door note. A patient is coming to you with a concern. Do as you would in your regular practice. Now, again, just reminding you guys, whenever you see a patient-centered case or this is such a door note presented to you, write your DOSAM abbreviation so you do not forget asking the right questions to the patient without wasting any time. Keep in mind that you do want to ask the patient all the right questions, however, you want to make them easy for the patient to understand and keep your empathy and sympathy skills out. And let's get started. Once you do go inside the door, you will see on your OSCE table some sort of reference and some sort of patient profile. This happens in most cases, so definitely use those 20 seconds wisely, And let's have a quick look at the patient's profile for today's case. This is the patient's profile. Have a quick look. Once you do that, the patient will enter the room. Look at them, smile, be confident, introduce yourself. Hi, I'm Tina. I'm the pharmacist on duty today. How could I help? Hi, I'm just hoping to learn how to use this device. I see. I appreciate you coming in today. Please have a seat. This is a private counseling area. Everything we discuss here will be confidential. So have you used this device before? No, I haven't actually. I was in a hurry yesterday and it seems like I did not really pay attention to what the pharmacist was saying. No problems at all. I'm happy you came in. Is it okay if I could ask you your name so I know how to address you? Yeah, for sure. My name is Dawn. I see, Dawn. So it seems like you've already been given this device out. So it seems like the pharmacist did check it to make sure this is the right medication for you. Any questions or concerns you had about the medication itself? Were you explained how to use how the medication acted in your body? Do you have any concerns about side effects or anything at all? No, I think I'm okay. I just wanted to learn how to use this device. I see. So from your profile that I saw earlier, I see you're Dawn and you are allergic to pollen and penicillins. You are taking the salbutamol inhaler and it seems like you were dispensed the Symbicort inhaler, Turbuhaler recently. Is that what you're trying to understand how to use? Yeah, the Symbicort Turbuhaler is the one that I'm trying to understand how to use. I see. I know it is different from other buffers, so this may be a little tricky to understand. I'm happy you came into the pharmacy to understand how to use it as opposed to just trying to use it some other way or just like a regular inhaler. It is always a wise idea to come to the expert and we'd be happy to help you. Apart from this, do you have any other questions for me? I was just wondering, do I have to shake this before I use it just like I do with my salbutamol? I'll definitely have a look at that for you as well, Dawn. Give me just a few minutes and I'll be back. So this is your reference, guys. Just let the patient know that you'll be looking into the reference. Make sure that when the patient is asking you a question, you understand their question. A lot of times, if it is a patient-centered question, we just assume that we have to ask them all the DOSAM questions. We have to go through any concerns that they have in terms of allergies, this and that. But you do have to understand what their question is and what the case is. If you take out that time and start asking them about the DOSAMs and all the other things, no problems in doing that, but you're going to be wasting your time. One more thing to be understood is that when a prescription has already been given out to the patient, it has probably been already checked and verified by the pharmacist for clinical accuracy. So you can definitely make sure or be certain that there's no problems with that. Again, no problems in double checking, but maybe a little bit of a time-consuming act. So let's have a quick look at our reference here, parts 1, 2, and 3. And then part 4 says, breathe out in a relaxed way as if you're completing a sigh. Part 5 will be, place the mouthpiece gently between your teeth, close your lips and breathe in deeply through your mouth. This draws the medication into your lungs and take the inhaler out of your mouth and hold your breath for 5 to 10 seconds, then breathe out. Part 7 says, if you take more than one dose at a time, follow steps 1 to 6 again. Remember, the medication is a turbohaler, is a fine powder. You may not taste the medication when you breathe it in. Now, all of us know that a dry powder will be lost if you shake the inhaler or turn it upside down. That will be the answer for her second question. In most cases, you will see that answer in your reference. Here, it is more of an implied answer. So let's go to the patient. Thanks for waiting, Dawn. I just wanted to look at my reference to make sure I give you the right recommendation and the answer. So the way we use this turbohaler is that it comes in a few parts. The first part is the cap that encloses the whole mechanism of the turbohaler itself. Once you're ready to use it, you do open up the cap, you twist it towards the left until you hear a click sound. Once you do, be sure that your dose is ready to be used. You can wrap your lips around the mouthpiece after exhaling so that you're able to breathe in all the fine powder. Now, because this is a fine powder, it does not have a propellant. You need to force the medication into your lungs. Therefore, you do need to apply some sort of pressure when you are taking the medication in. Now, the medication may be very fine. You may not actually feel the fine powder in your mouth when you're inhaling it. But do not worry, once you have heard the click sound and after you've exhaled, you wrap your mouth around the mouthpiece and you suck the medication in. Once you do that, try to hold your breath for about 5 to 10 seconds or as long as you're comfortable for, and breathe out through your mouth or your nose once that's done. If possible, just try to clean the mouthpiece with a dry tissue paper before you close the mouthpiece for another dose. Use it exactly as the doctor had said, and for these medications, we usually ask patients to rinse their mouth after every use to prevent any chances of oral thrush from happening. Did you understand any of these points? Do you have any questions with any of them? No, I understood what you said. Okay, that's perfect. Just to remind you, this is a dry powder, so do not shake it like the actual inhaler. That's the answer to your second question. You can always reach out to me in case you have any further questions. Always make sure to say bye to the patient in a good way and open up the case before you leave so they know who to contact. I hope this video kind of gave you a little bit of an idea on how to demonstrate a specific device. Reach out to me on any of these platforms that I've listed on the screen above in case you have any questions about an OSCE case, or if you want to practice with us, or even if you have any questions about your evaluating exams. I want to help as many people as I can, and I hope this video helped you in any small way.